So I would say that my biggest strength is that I'm very curious. I never just go through the motions of things. I always need to know the why behind what I'm doing. And I think that's really important, especially in an ICU setting where we're always using our critical thinking skills to not wait for something to happen, but to try to anticipate what's going to happen, to stay one step ahead of our patients. I think that's really important. And I'm not afraid to ask questions. If I'm not sure of something, I'm going to ask my nursing colleagues, someone with more experience, to make sure that I'm not putting my patient in danger. And then a weakness of mine, I would say that would be that sometimes I do get overzealous and undertake a lot of things, especially coming from a tech background before nursing school. I came into nursing school having to delegate tasks that I was used to performing before school. So I had to learn through my clinical rotations how to delegate those tasks, but also have that balance of checking in with my ancillary staff to make sure that they're not being too overworked, because I know what it's like to be on the other side of that.
Okay. I think those are really good. I like that. Are there any in the list where you were like, I have no idea what I'm going to say if they ask me that?
Um, I guess more so, well, I was for like strengths and weaknesses. I feel like, is that a
Um,
question I
yeah,
would
yeah.
say?
So we've kind of
Because
talked about strengths already, but like the weaknesses, you
yeah,
should definitely have something that you feel comfortable with.
okay. Well, I was trying to decide because I kind of have like two weaknesses, but I really just want to focus on one. So I
Yeah.
want to know which one makes me see more.
Yeah.
My first one was like my weakness is that I can be hard on myself and like
Okay.
I set really high standards for myself, but I am also really self-aware. So I know like when I'm starting to feel that way to really just change my mindset. And I
Hmm.
feel like having those high standards isn't only set for myself, but it's also set for like the care of my patients. So I really, want to make sure I'm giving my patients the best care that I can. Um, so that was one of them.
That's good.
Okay, but then my other weakness, I was thinking lack of experience, but that also plays into my strength because I'm really like dedicated to learn and really, want to gain more experience and excited to. I don't know.
For some reason, the first one like suits you more. I'm not sure why.
Okay. Okay.
Yeah, I would go with the first
Okay.
one.
Sounds good.
What are your biggest strengths and weaknesses?
Sure. So I would like to think that I'm a great communicator. I'm able to communicate with people. I'm not afraid to let people know what I don't know because I, again, never want to compromise patients' health or their care. I think that I'm outgoing. I bring a lot of positivity into the environment. I'm easygoing person. I work well with others. I love the fact that there's different entities that are caring for patients, and I think that they all bring something valuable to the team. So it's not just one person. So I just like that camaraderie, and I like making a difference in the lives of those that I come in contact with. I'm also I'm a hard learner. A fast learner. Sorry. Um, it doesn't take me long to learn something, and if it's something I don't know, I'm gonna research it first before I reach out and enlist the help of others. I'm gonna do my part and give it 110% before asking for help. And I guess one of the negatives I have is that I'm really hard on myself. It's easy for me to give advice, and I hear from friends that, wow, you really give great advice and you're a great listener. Um, but when it comes to myself, sometimes I beat myself up if I make a mistake or if I do something that I feel is could have been done better. So it's like just being able to be a little bit lighter on myself is something that I'm working on. And that's kind of where I'm at the with those answers, I guess.
So the first part, what I heard was like, I'm thinking, oh, well, she'd probably get along really well with these people in our unit. I think she'd be really good for morale. I think she would like blend into the family that we have already really well. So there's no problem there. Love that she's great with communication. And then when you talked about the weaknesses, I think being hard on yourself is something like all nurses go through. I think it's super relatable. Definitely a safe answer. What would you say are your biggest strengths and weaknesses?
My biggest strengths, I would say, oh wait, quick side question. Do I start off with like when I'm answering this, like should I start off with my weaknesses or do I start off with my strengths?
I would say whichever one they listed first and just
Oh,
give
whichever they listed first. Okay. Um, for my biggest strengths, I would say one of them is my ability to work well with others. I'm able to understand the team dynamics and develop a good relationship with team members and recognize the needs of a certain team and being able to address them as needed. Another strength of mine is that although I'm a new grad, I am very much enthusiastic and passionate about learning and being receptive to feedback and growing in this profession. And so I'm really looking forward to all of the learning opportunities that may come as I'm working in this job. And for my weaknesses, I would say that being a new grad can kind of serve as like this double-edged sword where although I have this passion, there is that possibility of me being uncertain with how to handle things and handling uncharted territory or uncertain waters for me. And so really being able to take that as an opportunity to use that as recognizing my resources and being double safe if I don't know anything, to make sure to ask the question and to know who my resources are. And so I would say that's my weakness, is insofar as just having like the lack of experience and confidence to be able to handle those different situations.
Cool. That works. What about strengths and weaknesses?
For my weakness, I will stick with that. I like to help others.
Yeah.
But because I like to help others, it will put me behind on my own work at times.
Yeah.
I think strength.
So with the weakness, like the deal is whatever weakness you talk about, you have to talk about it like it was a past thing. And like, because you know that about yourself, you like did this thing that helped make sure that that is like balanced in a way that won't affect your care.
Okay.
Yeah.
So I would say, because in the past, especially, having to give meds to like 30 plus patients, that right now, in the past, I would have helped my fellow colleagues with their workload, but because of that, I was getting behind on my own workload. So currently, I get all of my work done, and if I have a few spare minutes, I'll ask if anyone needs help with something and let them know, hey, I have like 5 minutes. Does anyone need help with something? So that way it's something that I'm not going to be on a time constraint with, and I can get it done fairly quickly and safely too.
Yeah. Yeah. And that kind of gives like a boundary, right? Like they know they have 5 minutes, so it better not be something that's like a 40-minute like dressing change or something.
Yeah.
Let's see.
I don't really know what to say for like strengths, because I guess I didn't really answer that part of the question. So
yeah,
maybe I feel like I have really good communication, like oral and written communication at work. And also I would say advocating for the patient too. A lot of patients will bring up their concerns to me, especially because, like I've said, I've built trust with a lot of them, so they're able to speak to me openly about their concerns. And a lot of times they're kind of nervous to ask the doctor certain questions, so I'll either ask the doctor for them or encourage them to do so when the doctor comes into the room.
Okay. Yeah, that's great.